So, good morning. This is Pradesh from OET for you. So, we are going to correct a letter that is provided in the group, and that is for Miss Sheila Cartwright's letter. The case note is already given in the Telegram group. Okay. So, what we are going to do is just discussing the case note first, then we will come back to the letter and we'll see the letter and correct the letter. Okay. So, the case note, that the reading time for the OET exam is 5 minutes. That 5 minutes time, you can read your case note carefully and classify your informations into relevant, irrelevant, and semi-relevant informations. Okay, then you should use all the informations, like which information you need to write the letter. You can categorize that and select that case note and write a good letter. Okay, so here in this case note, you can see that the notes is starting with a sentence that is, you are a registered nurse working at Fremont Community Hospital. That it is saying who you are. Okay, so then who is your patient? Your patient is Miss Sheila Cartwright and he's being discharged today. Okay, so Miss Sheila is going to discharge from your care today. So what's the details of the patient's history is already given below, like name of the patient, age, marital status, family, first admitted, discharge date. That is the date of the letter. That is what you are writing this letter on the 30th of April 2017 according to this case note. Okay, usually it is the examination date. Okay, so diagnosis is given, medical history is given, medications is given, what are the current medications she is on at the moment. Okay, so family background and nursing management that you had provided in the hospital while the patient is in your care. Okay, so again, discharge plan, what is the plan for this patient, and the writing task is given at the end of the case note. So you have to read this carefully in the 5 minutes time, and you can take another 5 minutes time and read it and plan your letter and write your letter. So important information I have to tell you, you have to read the writing task. So you can find what is the purpose of the letter. The purpose of the letter is to write a letter of discharge to discharge letter. Okay, letter of discharge to Miss Edith Penny. So the address is given in the writing task. So why we are writing this letter, that is the purpose of the letter. You can see that patient's conditions um, needs to be conveyed to Miss Edith Penny, including her medical and social needs. That means Sheila Cartwright needs some medical needs as well as social needs. So you have to, it should be two different categories: medical needs and social needs. So you can plan, like you can write about all the medical things in one paragraph, and then the social needs in second paragraph. Then you can summarize the letter. Either you can write like that or you can write in your own style. Okay, these are the planning of the letter. So then you have to ask questions, what all are these medical needs. So for to know that details of that, what is the medical needs for Miss Sheila Cartwright, you have to look above, that is what's happened to these patients and patient's discharge plan, what is the planning for this patient. So you can see that in discharge plan, monitor medication compliance. So medication compliance, why we need to monitor medication compliance is a question that you should assume that the patient had a non-compliance with her medication. That's why the reason we need to monitor medication compliance. So you need to club that informations into your letter. Okay, then again, blood sugar levels. So you already came to know that patient is diabetic. So you can know that the why we need to check patients blood sugar levels, monitor blood sugar levels. Okay, then alcohol intake and diet. So these are the why you should ask these questions, why we need to do alcohol intake monitoring or diet monitoring. So there should be some reason. That reason needs to be the background informations for your plan, or the for your the body of the paragraph should be the background informations. You have to provide all that information for this letter. Encourage SHEILA to do moderate exercise program. Suggest establishment of income producing activity. So why we need to do that? So you can find all that detailed informations in above this case note. Okay, so and again prepare a letter to community nurse. That is what we are doing now, and suggest involvement of community social service worker as well. Okay, so these are the important discharge plan for this letter. So then we will go and check what is the letter posted in the group, and we will correct it right now. Okay. Right, so this is the letter. So the date is absolutely fine. That is 30th April 2017. That is the date we are writing this letter, and the address is fine. Mrs. Edith Penny, Community Nurse. Okay, Fremont Community Health Center, Fremont. Dear Miss Penny, that's correct. Okay, so regarding Miss Sheila Cartwright, age at 69. Again, so this we are writing to introduce now. This is the introduction that is given already, so I just corrected it according to previously, like, this letter is being written to refer Miss Sheila Cartwright. Okay, so this letter is to refer Miss Sheila Cartwright would be fine. You don't need to write as much complicated. You can make it as simple as it. Okay, so this letter is to refer Miss Sheila Cartwright, who was diagnosed with diabetes mellitus. But in the information, it is clearly given that in the case note, she is also have small infected left foot ulcer. You should include that information as well, because the recipient want to know all the medical needs and the social needs, and the patient's needs to be aware of. Okay, so we need to include the second information as well. That is one important thing. And again, she requires monitoring, ongoing monitoring. It doesn't mention ongoing monitoring, but you can use ongoing monitoring, because we are checking blood sugar levels, weight, and diet intake, and alcohol intake, all that things. So she needs actually an overall lifestyle change, so that would be fine. But she requires ongoing monitoring and management of her condition would be fine. Okay, and again, it was in a different form. Is being discharged today. That's why she is being discharged today is better, because the both the informations are not in a similar kind of information. She requires ongoing monitoring and management of her condition. You can put a full stop, and then you can write she is being discharged today as a separate sentence. That would be a good option. Okay, so then next paragraph should be so the patient has got some conditions, so that's why the patient was admitted to in your hospital. So you can start with patient was admitted on this date with this compliance, and you had provided this and this care and all that things in your first paragraph. Instead of that, you had written that Miss Cartwright's past medical history. So the past medical history is relevant, but it is not too much relevant. You have to write your letter and design your letter as the priority wise, because what OET says is that, so you have to explain your introduction part later in the letter. That means if you says that she requires ongoing monitoring and management of her conditions, then the next paragraph should be explaining why she need ongoing monitoring and management of her condition. So you can write like, you have to change the entire structure of this letter in a different form. Okay, so this is okay. It's not up to the mark. That's what we are saying. So Miss Cartwright has had non-insulin dependent diabetes mellitus for the past 9 years. For which she was managed with a daily dosage of metformin 800 mg and glibenclamide 5 milligram. Okay, so that's a important information. The thing is that, so you club with that information with a different idea, with the social needs. So this is a medical um, information that you already provided in the first sentence. The second sentence, without any any transformation, you're just moving into a social information. Then again you're going back to the medical information. That is not a good suggestion. You can write, all the medical informations in that paragraph as we discussed below, already previously. So you can put all the informations that is relevant to medical needs, you can put it in one paragraph. Then you can discuss about the social needs in a separate paragraph. Then you can conclude your letter by providing the informations that already given in the discharge plan. Okay, so she is getting low amount of pension, and since retirement, and you have to put a full stop here. Okay, since retirement, and her alcohol consumption, her alcohol consumption increased, and dietary regime quality decreased. So since retirement, okay, so okay, that is the sentence structure needs to be corrected as well. So that's also somewhat correction needed for that. Sentence structure needs to be corrected as well. Okay, so you need some improvement in this sentence construction. So, and another thing, as I already discussed, one paragraph, one idea is the better idea to write a good letter. Again, so currently she is on antibiotic therapy. In addition, her glibenclamide medication needs to be continued. So again, what we need to do is we have to write a letter in a sequence way. Like, you have to say that the patient was admitted with this and this information, this and this diagnosis, and you had provided some care for that patient, and what is the current status of the patient, what you need to do, what the recipient needs to do towards that medical needs. Okay, then again, what is the present social status of the patient, and what the recipient needs to do towards that social needs. Okay, that is what we need to do like this letter. Okay, so then again you have to include what care provided with the patient in the hospital. Okay, so in the information given, it would be as we discussed in while discussing the case note itself, that is, you can include all the informations like why we need to monitor medication compliance, and why we need to monitor blood sugar levels, and why we need to monitor alcohol intake, and all these you should ask these questions, and you will get the answer from the case note. Then you can restructure this letter and correct it. Okay, so this is not the kind of letter what OET is expecting in your to be a B grade. You have to correct a lot. So the sentence structure needs to be corrected. So okay, so the major mistakes again, sorry. So okay, so the major important corrections what you need to do is sentence structure. Okay, sentence structure needs to be corrected. Then one idea in one paragraph, then mixing of informations needs to be corrected. And plan your letter well. Plan your letter according to priority wise. Advice. Okay, so this is all basic things you can do with your letter, and probably you can come back with a different letter and post in the group, and we will correct and put it as a video in the group. Okay, thank you for writing a letter in the group, and expecting all of your um, suggestions and your ideas to correcting this letter. And this we have a YouTube channel as well. Please share to your friends, and this group, please share the group as well. Thank you.